Hey, this is Dr. Rob Franklin with FullBucket. I want to tell you about an exciting product that we've got for managing acute and often severe diarrhea. It's called our ADD or Anti-Diarrhea Drench BioClay Plus. So that's a mouthful, but what it is really a very multi-faceted approach to dealing with diarrhea. Now this product comes in a paste form, and it also comes in a bucket, either a 1 kilo or a 5 kilo that can be administered using the stomach tube. Of course, the paste can be administered orally. The key components of the product come from dealing with lots of diarrhea. Myself as someone who's run many intensive care units and dealt with severe cases of enterocolitis and endotoxemia. You know, you have certain things that you're trying to accomplish when dealing with those cases. And one is you're trying to mitigate the toxins. So we're talking about endotoxins and exotoxins. And these are largely responsible for many of the signs that we see in these acute diarrhea cases: the fever, the tachycardia, the injected mucous membranes, the loss of blood pressure, the dehydration, oftentimes laminitis is a sequela there. And it leads to more leaky gut as well, and so we're going to lose fluids in the gut. So trying to control those toxins is a key component, and the way we do that is we use a calcium Montmorillonite clay, which is a clay that is an adsorbent clay, so it's not a clay that swells, but it is a clay that has a very, very large surface area, and that surface area allows it to bind toxins and then carry them out. So you don't have to worry about the risk of constipation or obstruction by giving the clay, as with some clays that will actually absorb water and could obstruct a horse as it's getting over it. So using the clay to eliminate toxins is a key component. And then once we've eliminated the toxins, we also need to go in there and repopulate the gut with some healthy microbes. And what we use is Saccharomyces boulardii or Saccharomyces cerevisiae, variation boulardii. So these are the different names for the same organism, but this is the most research-backed organism that is out there for a probiotic. It's nice because it's a yeast and you can use it with antibiotics. You don't have to worry about antimicrobials killing the probiotic. And it has been well studied in dealing with cases of salmonella and clostridium as far as removing toxins and helping eliminate those pathogens from the system. So Saccharomyces boulardii is going to come in a full strength dose whenever you administer the ADD BioClay Plus. And then you're also going to get a large dose of a prebiotic. Again, prebiotics are there as fertilizer for the healthy microbes. So we've oftentimes got a disrupted ecology or microbiome in the hindgut, and we're trying to put in fertilizer to allow the normal microflora to come back and to expand. So you want to have plenty of prebiotic to feed them. So we've got probiotic in there, we've got prebiotic, and then we want to make sure that we are providing electrolytes so we can rehydrate the patient. Oftentimes we're losing tremendous amounts of electrolytes, and especially things like calcium and magnesium, which aren't going to be found very often in some of your electrolyte replacements. And so we provide these in a chelated form, which means that they're rapidly absorbed. So if you're just feeding a regular type of calcium and magnesium type of supplement, that form may not be absorbed or may be absorbed very poorly, but having the chelated variety of these electrolytes allows for rapid absorption. So we're able to rehydrate the patient with the use of the electrolytes. We're able to repopulate with the use of the Saccharomyces boulardii, and then expand the normal microbiome with the prebiotic. And then we're eliminating toxins with the clay, and we're also providing some L-glutamine to feed those enterocytes that are oftentimes that is a limiting amino acid, especially during disease. And remember that enterocytes live off of L-glutamine, so it's very important that that is there for them, especially during times of injury. So again, we're going to provide this in a paste form. I like to use the paste form in folds. So a typical fold is going to use anywhere from 1/4 to 1/2 of a tube. I'm going to administer that up to a couple of times a day, and I'm going to use that until the foal's diarrhea is under control. And then I'm going to switch over to a probiotic without the clay. And so this is great to be used for foals. It can also be used in weanlings and even adults. So weanlings, you're going to up that dose to 1/2 to 1 tube, up to twice a day, and then an adult's going to get 1 to 2 tubes. And so oftentimes if I'm out in the field and I'm treating the diarrhea, I may tube the horse with the BioClay Plus and then leave a few tubes of this behind along with some probiotic paste behind, and so that the client can follow up with giving the paste later on that day or the following day, and they can continue to give the paste until the diarrhea is under control, and then they can switch over to the probiotic paste and continue that. And then as far as using the powder, so I like to use the powder in the clinic. I also keep one of these on the truck, and this is easily administered. It flows very easy with a nasogastric tube. It's a bit like making gravy, so I do start with the powder and then add the liquid, and typically adding 6 liters of water for every kilo of powder is going to be a perfect mixture. You're going to be able to hydrate the horse with the fluids that you're adding in there. And then if I'm scaling back and I'm just giving that to a weanling, I may give 1/2 of a tub, and I'm going to give 3 liters of water. And a foal, depending on the size of the foal, you may give anywhere from 1/8 to 1/4 of that kilo, and then reduce the amount of water proportionally. And the tub does come with a scoop, and so you can use 1 scoop per 250 pounds is another way to think about it, but 4 scoops is going to be a full kilo and a full strength dose. We also have this available for our pets, so you can use a similar rationale when dealing with acute diarrhea in dogs, and it has the same basic principles, and we're doing the same types of things. So this is the ADD BioClay Plus. It's available through your distributors, and it is a great solution for acute and often severe diarrhea and getting control of those patients. I'm Dr. Rob Franklin, FullBucket. Give me a call, shoot me an email if you have any questions, and I'd be happy to help you out with this. I hope you find as much success with these products as I do in my practice, and take care.